A laparoscopic cholecystectomy is a keyhole operation to remove the gallbladder. It's an operation that is done under general anesthetic, and 4 holes are made in the upper part of the abdomen through which laparoscopic instruments are inserted and the gallbladder is removed. If this operation is done in a planned fashion, and we call this as an elective laparoscopic cholecystectomy, patients can be discharged on the same day or the morning after surgery. Basically, they can be done as either day cases or just on a 24-hour or a 36-hour stay in the hospital. But if the same operation is done in an emergency setting, they may have to stay in the hospital a little longer. It's a relatively safe operation and it's widely performed. However, there are some risks, just like how there are risks with any operation. This operation also comes with risks. There are some general risks like bleeding and infection and risks related to the anesthetic. But specific to this operation, there is a risk which we call as injury to the bile duct. Thankfully, with increasing expertise and advancement in technology, these risks are extremely low, and most of the time patients simply sail through the operation. After a laparoscopic cholecystectomy, the recovery is usually quite good. Patients are expected to get out of their beds and start walking in about 4 to 6 hours time. There is no specific dietary restriction after this operation. They can basically start eating and drinking as normal from the next day onwards. The pain that they experience is minimal, and most of the time this is well controlled with just a few tablets of paracetamol over the next few days. The holes that we make to perform this operation are all closed with absorbable sutures, and these sutures dissolve away very well in a few weeks' time, and therefore there's no hassle of having to go to a doctor or a nurse for suture removal or anything of that kind. The scar that the patient eventually gets is hardly visible after a few months. Sometimes when patients come back to the doctor after several years, and if the doctor happened to ask the patient, could you please point out exactly where those holes are, the patients find it hard even to precisely locate where exactly they are. Such is the level of healing that usually happens. The scars completely fade away, and the patients have completely forgotten that they've actually had an operation.